This is Maritza Munoz. In this presentation, we'll be talking about Hildegard Peplau, the mother of psychiatric nursing. Hildegard Peplau was born September 1st, 1909 in Reading, Pennsylvania. She died March 17th, 1999 in Los Angeles, California. She created the first graduate program for clinical specialists in psychiatric nursing at Rutgers University. She worked with the World Health Organization as an advisor, and she served as a consultant to the United States Surgeon General, the United States Air Force, and the National Institutes of Mental Health. She published a book based on Sullivan's interpersonal theory and emphasized the nurse-patient relationship and conceptualized the 4 levels of anxiety. And we'll be talking about both of these in this presentation. The nurse-patient relationship concept was introduced in 1952. There are 4 phases: the pre-orientation phase, which is data gathering, the orientation phase, which is defining the issue, the working phase, which is the therapeutic activity, and the termination phase, which is the termination of the relationship. The pre-orientation phase happens before meeting a patient. So you want to review available data, including the medical and nursing history, talk to other caregivers who have information about the patient, anticipate health concerns or issues that arise, and you want to plan enough time for the initial interaction. Next, we have the orientation phase. When the nurse and patient meet and get to know one another, set the tone for the relationship by adopting a warm, empathetic, caring manner. Recognize that the initial relationship is often superficial, uncertain, and tentative. Expect the patient to test your competence and commitment. Closely observe the patient and expect to be closely observed by the patient. Begin to make inferences and form judgments about patient messages and behaviors. Assess the patient's health status. Prioritize the patient's problems and identify his or her goals. Clarify the patient's and your roles. And let the patient know when to expect the relationship to be terminated. The third phase is the working phase. When the nurse and patient work together to solve problems and accomplish goals, maintain the relationship, gather further data, promote the patient's problem-solving skills, self-esteem, and use of language, facilitate behavioral change, overcome resistance behaviors, evaluate problems and goals and redefine them as necessary, and promote practice and expression of alternative adaptive behaviors. The last phase of the nurse-patient relationship is the termination phase. During the ending of the relationship, summarize the goals and objectives achieved in the relationship. Discuss ways for the patient to incorporate into daily life any new coping strategies learned during the time spent with the nurse. Review situations that occurred during the time spent together, and exchange memories, which can help validate the experience for both the nurse and patient and facilitate closure of the relationship. In addition to the nurse-patient relationship, she also conceptualized 4 levels of anxiety. This includes mild anxiety, moderate anxiety, severe anxiety, and panic anxiety. For mild anxiety, this is normal. The stimuli in the environment are perceived and understood by the patient, and learning can easily take place. In moderate anxiety, there is a heightened sense of awareness. The perceptual field is narrowed, and the individual hears, sees, and understands less. Learning can still take place, although it may require more direction. In severe anxiety, this interferes with clear thinking and the perceptual field is greatly diminished. Nearly all behavior is directed at reducing the anxiety, and learning and problem solving are not possible. In panic anxiety, this is overwhelming and results in either paralysis or dangerous hyperactivity. An individual cannot communicate, function, or follow direction. This is the sort of anxiety that is associated with the terror of panic attacks. Here are some strategies the nurse can use to help reduce anxiety in patients. For mild to moderate anxiety, the nurse can help the patient focus and solve problems with the use of specific communication techniques, such as employing open-ended questions, giving broad openings, and exploring and seeking clarification. For severe to panic levels of anxiety, moving the person to a quiet environment in which there is minimal stimulation and providing gross motor activities to drain some of the tension will help. The patients are unable to solve problems and may have poor grasp of events occurring in the environment, so you want to use firm, short, and simple statements. So in this presentation, we talked about the nurse-patient relationship, which includes the 4 phases: the pre-orientation phase, orientation phase, working phase, and termination phase. We also talked about the 4 levels of anxiety, which include mild anxiety, moderate anxiety, severe anxiety, and panic anxiety. And I just have 2 questions to help initiate some discussion. How would you help a patient reduce their anxiety? Have you applied this theory during clinical or your preceptorship? If so, how? Here I have my references, and this concludes my presentation.